So this is the system, the RobotiX Mentor, and it's set up like what we see in the operating room. You have a separate console, which my fellow Dan is sitting at right now, and he has joysticks. You have an adjustable height. It's 3D visualization. The pedals are exactly how it's set up with the RobotiX console. And what we're seeing here is what he's seeing in there. We're seeing it in 2 dimensions, he's seeing it in 3 dimensions. One thing that struck me when I saw this is not just the accuracy of the anatomy. I mean, what you're looking at here is bladder, prostate, going into the apex of the prostate, but it's the tissue dynamics. It really is extremely realistic compared to what we're seeing in the operating room. And what Dan is doing right now is he's identifying the bladder neck, which is the junction between the bladder and the prostate. And you can see how the tissue responds to being pushed and even being dissected. Also, there's bleeding. There's a separate assistant port here where someone laparoscopically can go in and suck and irrigate and simulate what you'd actually see in the operating room. Dan is going through the bladder neck right now, and what it's showing him to do is to go, what the green says is, this is where you need to go next. And this is one of the hardest parts of the operation to teach in the operating room. So the fact that my trainees can come in here and actually get the experience here before going there. And Dan is a fellow, right? So he's already completed a residency. And so he has a lot of experience with robotic surgery. So something like this is completely applicable to his level at this point. So here's the catheter inside the bladder neck, and now it's telling Dan to use his 4th arm, so he'll toggle over to it, and this is exactly what we do in the operating room. He's going to grab the Foley catheter, and the nice thing is that it's actually telling him to do this, right? So if you don't have any experience with this operation, then it's going to walk you through these steps. So he's taken the 4th arm, lifted up the Foley catheter and exposed the posterior bladder neck. You can see the green, it's telling him that's where to cut, and now he's going to come through the posterior bladder neck. And again, this is the hardest part to teach in the operating room.